Health Minister designate Menu says government has initiated processes to reduce the cost of the COVID-19 test fee at the Kotoka International Airport to conform with the cap placed on the cost for member states by ECOWAS for intra-regional travelers. Travelers are currently paying $150 for the mandatory test at the Kotoka International Airport as part of protocols to stem the spread of the virus. But following a decision by ECOWAS at the 58th ordinary session of the Authority of Heads of State and Government, which capped at $50 the cost of COVID-19 PCR tests, Mr. Menu says the administration has taken notice and already commenced processes to comply with the directive.
Indeed, my colleague from Northtown mentioned the ECOWAS protocols and the review issues that has actually capped the test at the borders to $50. The President has actually given orders that we should quickly make our implementation modalities to try to see how best this can be implemented in our country. And I believe even if at least ECOWAS citizens will be able to access the test at the airport at the $50 as has been agreed by the ECOWAS community. But the $150 didn't come for nothing. Mr. Speaker, the infrastructure that was put at the airport to try to do this test efficiently was quite unparalleled around the whole world. People who were traveling across Europe and America will come and will testify to this. And all these things come at a cost. But we're taking a good look at what is now on the board, and I believe things will begin to ease up a little bit for us, and this will be looked at favorably.
On decongestion of classrooms, Mr. Menu announced that guidelines have been circulated to help schools to run a semblance of shift system in schools to stem the spread. He also called on private citizens to play their part to help stem the spread.
Citizens are living up to the task to support government efforts and government initiatives. Mr. Speaker, I know, and this was announced and they made a press by the Ghana Education Service, close to about 23 million face masks have been ordered to be supplied, and distribution is ongoing. In some places we have served adequately, in some places, like my colleague said, things are yet together. But we have triggered monitoring to follow up to make sure that every district has got what has been allocated to them based on the population of children. And I like what my colleague, the honorable member from is it Chibi or Wapasaf, Honorable Atacha, said that we should also play voluntary roles as parents and citizens to complement the efforts that government is actually making. Mr. Speaker, there are arrangements for classrooms to be decongested, and these guidelines have gone out. Teachers have been trained, said that in classes where we have large numbers, they will break them into two and begin to run some semblance of a shift system so that we don't actually congregate these students against the protocols that we have actually initiated.